In this second instalment of my conversation with menopause specialist Dr. Tina Peers, we discuss low sex drive, flagging libido, and feeling depressed. Have a look. Body odour changes. Now, is this something that, are we talking sweating, are we talking intimate body odour, or everything?
Both.
Okay.
Both. It's all chemical balances.
Yeah. Would it be your breath as well, or mainly
generally
just
not
sweat?
the breath, but but the sweat has a slightly different composition.
Yeah.
And vaginally,
Yeah.
when you have a lot of estrogen in the body, the lactobacillus are the predominant bacteria which keep the other nasty ones at bay, such as bacterial vaginosis and thrush.
Yeah.
But unfortunately, at the menopause, perimenopause, often women complain of frequent infections because the lactobacillus get up and leave, and other bacteria, especially BV, which can have a horrible fishy smell, come and move in.
Okay.
And you don't want that to happen. So it's very important for women who are at the menopause to ask their GP for some vaginal estrogen as well, even if they are on HRT.
Okay.
And the vaginal estrogen helps to keep the vagina in a really good environment for the lactobacillus to be maintained. It also is local estrogen that helps the bladder to be more stable and calm.
Okay.
So they'll get up in the night less to pass urine.
Right.
They won't have so much stress incontinence, or etc. etc.
Yeah.
So it's a win. It's a win-win.
Will it help urine infections as well?
Yes, may well do,
Yeah.
because it just makes it more robust and healthier, the whole area. Urogenital atrophy is what we call the condition when women are postmenopausal and they're struggling with no estrogen. And urogenital atrophy is a chronic disease that will continue to get worse and worse with every year. So the vagina goes from being a lovely sort of elasticated, corrugated, red, moist, fit for purpose kind of place, full of lactobacillus. And then it will go from that to being a very pale, thin-walled, dry, small, inelastic, rigid kind of place. Painful. Something tries to go in there, it just tears the skin. So very unpleasant, enough to put you off having sex, and a real problem, a real issue. So another one of the symptoms, which we haven't discussed yet, is libido.
Yes, of course.
Big one.
Yeah.
Big one. So
I
women
mean,
find...
It's absolutely understandable that obviously if sex is painful and you're feeling anxious, stressed, depressed, tired, all of these things, generally not feeling like yourself, you're not even going to notice that you haven't got a low libido, because you will just put it down to that's why I'm not feeling like it. But actually a low libido is a key sign.
It is a key sign. And some of the women come and they're so sad about it. And they say, I used to really enjoy sex and it was a great intimate thing that we did together. It was wonderful. And now I'd rather read a book. Yeah. Preferably your book. But why not?
And if they read my book, they would know what to do to feel better.
Yes, exactly. I would suggest it. I would recommend it. But, it is a big problem, a big issue between couples.
Yes.
I really believe that men need sex to give affection, and women need affection to give sex. And if sex doesn't happen, the whole thing just sort of is, could be quite traumatic for everybody.
It's no surprise that many marriages fall about the time of the menopause. And if the way I see it, if the man doesn't understand what's happening, because what's happened to the woman that he loves, and then we don't understand it, how can we help them understand it? So I think it's really important that communication is kept open, and if women can say, I'm feeling this and this, it hurts, it's not you, I just don't feel like it. And then you can look into, these are my symptoms and what can I do about it.
And most women come and say, my partner is lovely and he understands, but I know that it's not good. It's not good for us as a couple. And he's not pressurising me and he's very sweet about it, but actually it's not ideal.
Obviously painful sex is something that is not just going to affect the woman, it's going to affect the man as well, because if sex is painful, you're not going to be interested.
No, absolutely. So there are a number of things that women can do to help. They need to ask their GP to prescribe them some vaginal estrogen, and that can be a pessary, which they use at least twice a week, and they can use 1 or 2 twice a week, or a cream. So some women prefer to have a cream, that's fine, and they use that 2 or 3 times a week. So that's the first thing. And that should be taken long term, forever. because otherwise the urogenital atrophy will return and just get worse and worse, which is no good. So that's the first thing. The second thing they could do is use some lubricants, but the correct lubricants, when they are going to have sex.
So when you say the correct lubricants, obviously if you've been sexually active since your, I don't know, 20s or what have you, it's a different type of lubricant that you need when you're menopausal, or is there just certain things you need to look out for?
I think there are certain things we need to look out for. We know that there are certain lubricants are what we call equiosmolar. So they are the same concentration as the vaginal cells. If they're not, they will either make water pass into the cell or water pass out of the cell. So I'm afraid an awful lot of branded lubricants out there are not suitable for any women, whether they're young or postmenopausal. So it's very important to use the ones that are equiosmolar and are recommended by, say, the British Menopause Society and other websites that know what they're talking about.
So is that if this is something that you're keen to find out more about, is that the way to go about it? Have a look on the website and see what they recommend.
There's about 4 or 5 that are recommended for postmenopausal women, but I would say even younger women shouldn't be using KY jelly and various other baby oil and things like that, because that's not good.
Okay.
The other thing that is recommended is you can buy some specific soaps and moisturisers for that area, for the vulva, and we would recommend that women use special soaps rather than any old soap, which can be a little bit too harsh. Yes.
Okay.
Yes.
Is it true? I've heard that actually you shouldn't use any soap and you should just use water, but should you use some soap?
The vagina is actually self-cleaning.
Yes.
But we are creatures of habit, aren't we?
Yeah.
But yes, water is fine.
Hard to stop when you're washing
Yes,
everything else.
it is. It is a little bit. It is a bit difficult. So yes, water is fine.
Yeah.
But if you want to use something specific, then get a particular vulval soap, something very, very soft and gentle. The other thing is there are probiotics on the market which you can buy over the counter for the vagina. So if you have had any antibiotics or treatment for thrush, etc., it's a good idea to use a probiotic maybe for a few nights to just get the lactobacillus back.
Is that a tablet or no? It's a pessary.
It's a tablet that way, pessary.
I have never heard of that.
Yeah.
Okay.
Yes.
And that's just from health food stores or places like that?
Yes,
or
online. Chemists,
Or chemists.
Yes.
Okay.
Yeah.
Burning tongue and a dry mouth. This is something that I hadn't heard of.
No. So not all women talk about that, but some women notice it. And again, when you give them HRT, they feel very much better. It improves.
Yeah.
That's not a very common one, I would say, but it can be. Yeah, it can be.
So something just to take note of.
Yes.
Some of these we've touched on already. If you just joined us and you're wondering what I'm looking at, it's my book. We've got all the 34 symptoms of the menopause listed on here. And the reason that I've got the book out is because we are on D, which is difficulty concentrating. And we got off track, we couldn't remember where we were going. But we can kind of lump a few in together, I suppose. I mean, difficulty concentrating, dizziness. That's unusual. Is that because of a change in blood pressure, or what's the reason?
We're not quite sure why some women should get that and some women don't. Again, I think that might tie in sometimes with the histamine intolerance.
Yeah.
Women who are progesterone sensitive, they can, as part of their histamine symptoms, they can have dizziness, palpitations, sweats, and so on. So that, again, that's quite a specialist area, really.
Yeah. But again, HRT will
HRT will definitely help, the right HRT.
Okay.
So, and as I said earlier, we do like to encourage transdermal HRT because that does not increase the risk of blood clots.
That's interesting, actually, because that's one of the things that often does get raised. We touched on breast cancer worries previously, but blood clots is definitely a concern.
It is a concern, and it just needs to be completely understood and properly explained.
Yeah.
So if you have transdermal estrogen, you do not make more clotting factors, and therefore you do not increase your clotting risk.
Okay.
If you have oral HRT, it is metabolized by the liver, and the liver makes the clotting factors. Right. So it gets a little bit busy and it makes more clotting factors than usual, just a little bit,
Yeah.
for a few months, and then it resets to normal.
Okay.
So I do have some of my patients on oral because they don't absorb it through the skin very well for one reason or another, and they prefer to take it orally, and it's fine. We just ask them to stay well hydrated for the first 2 or 3 months, which is a good idea anyway, and to take maybe an aspirin, enteric-coated aspirin, if they can tolerate that, to thin the blood for the first couple of months that they're on it, and then it resets to normal. But if they have to go in for an operation and then they're on oral, the surgeons will ask them to come off it because of this increased clotting risk. Even though it will have reset to normal, there's a little bit of misunderstanding going on there.
Okay.
If you're on transdermal, you can...
Then it's fine.
Yes.
Okay.
Yeah.
Electric shocks, tingling sensation.
Affecting the neurological
Yeah.
system. It can affect everything.
Okay. And is
But
that
virtually-
something that is uncommon?
Uncommon, but a lot of women get carpal tunnel syndrome when they are postmenopausal, perimenopausal, which they can also get in pregnancy.
Yes.
So it's when you wake up in the night and you feel like your fingers are sausages and it's really painful and uncomfortable, and you have to wriggle them free, and then the circulation improves.
Yeah.
That increases.
Okay.
Yeah, so there's a whole load.
So far I'm ticking every single one of
Oh,
these.
it's terrible, isn't it?
It really is.
It really is bad. And I think one of the biggest things is feeling flat and depression,
Yeah.
and just feeling like women feel, I just can't get excited about anything. And then they feel guilty about that because they think, life is good. Why am I not happy and buzzing like I usually am? And the life and soul of the party, or full of energy and enthusiasm for things. And that is the horrible one. And a lot of these women are diagnosed with depression when they're not depressed. It's their hormones that are failing them. And they're given antidepressants and they don't get better. And what they actually need is to have some HRT. So this is something that I really want women to be aware of. CBT is helpful with the menopause. A lot of women find that having some CBT, mindfulness and all of this sort of thing, but I think that just helps all of us actually with whatever we're having to deal with in our lives at that time. But for actual sort of, real...
Clinical depression.
Yes, it's depression, feeling flat, just not feeling yourself.
It feels like your pilot light has gone out.
Yes.
And there's no there's you know what I mean?
Yes.
Our boiler's in the kitchen, so when the pilot light goes on and off, that's how I sort of feel. And that's what it's sort of, that sound sort of resonates with me. When that spark of joy when something lovely happens, when that doesn't happen anymore, it's almost as if the colour's been turned down in the world.
Absolutely. And I have women describe themselves as feeling like a non-person and having lost themselves. And then when they go on to the HRT, they feel like they've come back. And their husband's saying, my wife is back, How wonderful is that? So it's, a lot of women describe those symptoms.
You mentioned meditating and that sort of thing. Is that something that you would recommend as well as taking conventional medicine? I think that a healthy lifestyle is important for all of us, no matter what our age is. And it's never too late to start. So healthy diet, exercise, good sleep, don't smoke, minimal amount of alcohol. Obviously, I don't want to be a party pooper, but keep it not every day and so on, and not to overdo the drink. Keep a good healthy body weight. That's very important. We know that obesity and being overweight increases the risk of cancers massively, and heart disease and diabetes and so on. So it's really a no-no. Very important to have some weight control. Not just for the menopause.
Not just for the menopause. But obviously at the menopause, women it's a time to maybe recalibrate and think about your lifestyle and what you're doing and how to stay as healthy as possible for the next half of your life. Because we're going to live a long time, There's life expectancy is huge. There's a website where you can put in your age and everything, and they tell you your average life expectancy. Mine's going to be 89.
That's great.
Yeah, average.
What?
So
What if it came back and it said 2 days' time? Really devastating.
I don't think it can be that accurate. No, but life expectancy is massively increasing. So we need to be as healthy as we possibly can be for as long as possible, so we can live independently. We're not going to be a burden to our children, to the NHS, healthcare, etc., etc.
But also, I think one of the reasons that we're seeing more people talk about the menopause, it's something that is it's a cause incredibly close to my heart. But it's because women are living longer and they're staying in the workplace for longer.
Yes.
So this is an issue that is not just to do with each individual woman. It's a national issue.
Yes.
We need to think about it in terms of our economy.
Yes.
We need to think about it in terms of our relationships. So we're talking ourselves, our parents, our children. The concentric circles spiral out and out.
Absolutely huge.
Dealing with the menopause is much bigger than just making one woman happy.
Well, 1/5 of the population are women over the age of 50. So that's actually 13 million women in this country, many of whom, as you quite rightly say, are running families, running households, keeping jobs down, looking after elderly parents, etc., carers, etc.
Yes.
So it's massive.
Yeah.
And we've got to keep that huge cohort of women who are, big part of our workforce and social workforce, fit and healthy and functioning fully.
And support them.
Absolutely.
I get so cross about it. Very few things make me cross, but I get very, very cross. Paddington stare to anyone who isn't supporting us.